Have you ever wondered if the quietest person in the room is hiding the greatest story? What if the nurse everyone overlooked had once saved lives where every second meant the difference between life and death? Every morning, Lena Carter arrived at Pine Valley Medical Center before the sun came up. Most people never noticed her. She preferred it that way. She parked in the far corner of the nearly empty parking lot where only one old streetlight still worked. The spot was always quiet. No one parked there because it was too far from the entrance, but Lena liked the extra walk. It gave her a few minutes to prepare herself before another long day. She sat inside her small blue car for a moment before getting out. Her hands rested on the steering wheel while she took one slow breath after another. Inhale. Hold. Exhale. It was a habit she never talked about. When she finally stepped outside, cold morning air greeted her. She grabbed her backpack, locked the car, and walked toward the hospital without looking around. Inside, the smell of coffee mixed with disinfectant filled the hallway. The night shift nurses looked exhausted. Doctors hurried past carrying patient files. Machines beeped from different rooms. To everyone else, it was just another busy morning. To Lena, every sound carried meaning. She could tell which monitor belonged to an elderly patient. She could tell when oxygen was flowing correctly. She could even hear when an IV pump was about to alarm before anyone else noticed. But she never said anything unless someone asked. She was only a nursing student. That was how everyone saw her. Nothing more. At the front desk, senior nurse Emily handed her a clipboard. Morning, Lena. Good morning. Supply room first. Count the emergency equipment. Yes, ma'am. Lena smiled politely and walked away. Nobody noticed how quickly she scanned every hallway. Nobody noticed how her eyes automatically located every exit. Nobody noticed that she quietly memorized where every emergency cart stood. To her, it was automatic. She couldn't stop doing it. The supply room was small and crowded. Boxes were stacked everywhere. Some shelves looked ready to collapse. Most students would have started counting immediately. Lena stood still. Only for 3 seconds. She studied everything. Emergency airways. Trauma kits. Chest tubes. For fluids. Tourniquet packs. Everything had a place. Everything needed to stay reachable. Without making a big deal about it, she moved 2 heavy boxes that blocked emergency supplies. She placed them on another shelf. Then she started counting. Every number was written carefully. Every expiration date checked. Every damaged package placed aside. When Nurse Emily returned 20 minutes later, she looked surprised. You finished already? Yes. Emily looked over the clipboard. Everything was perfect. You reorganized this room? Only the items blocking emergency equipment. Emily looked around. You weren't asked to. I know. For a second, Emily looked confused. Then she shrugged. Fine. Lena simply nodded. No argument. No explicación. The morning continued. She cleaned patient rooms, changed bedsheets, delivered blankets, restocked gloves, answered call bells. Some nurses thanked her. Some forgot she was there. One doctor barely looked at her. Dr. Harrison Blake had worked in emergency medicine for almost 30 years. He was respected, experienced, brilliant. He also expected perfection. As he walked past Lena, he stopped. The hallway outside room 5 needs cleaning. I'll take care of it. You missed it earlier. I hadn't reached that hallway yet. He looked at her for a moment, then simply said, Do it now. Yes, doctor. Lena grabbed a mop. She cleaned the hallway without another word. She didn't mind. She wasn't there to impress anyone. At least that was what she kept telling herself. Late that morning she entered room 7. An elderly patient smiled as she walked in. You must be the student. My name is Lena. I'm Walter Brooks. She checked his blood pressure while he watched her carefully. You've done this before. I've done clinical training. Walter laughed softly. No. He shook his head. I mean before nursing school. Lena continued wrapping the blood pressure cuff around his arm. I've had different jobs. You don't move like a student. She smiled politely. I'm still learning. Walter stayed quiet. When the machine finished, Lena checked his pulse manually. 1 beat. 2. 3. A tiny pause. Then another. Almost impossible to notice. She checked again. The same rhythm. What are you thinking? Walter asked. Have you felt dizzy today? A little. Any chest discomfort? Not really. She wrote down his vital signs. I'll let your nurse know. Walter looked at her. You already know what's wrong, don't you? I noticed something I'd like someone to evaluate. You speak very carefully. She smiled. It's important not to make patients worry unnecessarily. Walter chuckled. You sound like someone who's learned that words matter. Lena finished writing. As she reached the door, Walter spoke again. You've worked around emergencies. She stopped. Only for a second. What makes you think that? You never stand with your back to a doorway. Lena didn't answer. She quietly left the room. Back at the nurse's station, she found Emily updating charts. Mr. Brooks has an irregular pulse. Emily looked up. How irregular? Brief pauses. Symptoms. Mild dizziness. I'll tell Dr. Blake. Emily thanked her. Lena moved on to another task. She never checked whether anyone listened. She had learned long ago that repeating herself rarely changed people's minds. Around noon, she sat outside for lunch. A simple sandwich. A bottle of water. Nothing else. She chose a bench facing the parking lot. From there she could see every ambulance entering the hospital. Old habits. She watched one ambulance arrive without lights. Stable patient. No ruse. She knew before the doors opened. Then another ambulance arrived. This one faster. Different. Emergency. She instinctively stood. The patient was rushed inside. Lena's hands tightened around her water bottle. For one brief moment. The ambulance disappeared. Instead, she heard helicopter blades. Dust. Smoke. People shouting through radios. A voice screaming for help. Lifeline. We still have survivors. She blinked. The hospital parking lot returned. The ambulance doors closed. Everything became quiet again. She sat back down. No one noticed. She finished only half her lunch. The rest went into the trash. That afternoon, Dr. Blake reviewed Walter's chart. His rhythm looks fine. Emily looked uncertain. The student noticed irregular beats. Dr. Blake sighed. Occasional skip beats aren't unusual. Lena happened to be replacing supplies nearby. She remained silent. Dr. Blake continued. No further testing. Emily nodded. Lena simply continued organizing bandages. She never interrupted physicians. Not anymore. Later that day another patient arrived. An elderly woman named Grace. She seemed confused. She couldn't remember where she was. Her son looked terrified. She was perfectly normal yesterday. Dr. Blake ordered blood work. Lena quietly listened while preparing equipment. The son mentioned something unusual. My family doctor told her to drink lots of water. How much? Lena asked. Almost a gallon every day. Lena looked toward the examination room, then back at him. For how many days? Nearly a week. Her attention sharpened immediately. She remembered something she'd learned years ago. Too much water. Confusion. Weakness. Possible sodium imbalance. She quietly continued working. 20 minutes later. The laboratory called. Emily answered. Her expression changed instantly. She looked toward Dr. Blake. Sodium is 116. The room became silent. Dr. Blake immediately ordered treatment. As Emily prepared medication, Lena quietly stepped closer. Doctor. He looked up. Yes. The initial treatment is correct. He waited. But the continuous correction may need to be slower until we're certain how long the sodium has been low. The room froze. Dr. Blake studied her. You're giving treatment advice? I'm sharing a safety concern. You are a student. Yes. Silence. Finally. Dr. Blake turned toward the computer. He adjusted the order. Emily glanced at Lena with surprise. The patient received treatment. Within hours. She slowly became more alert. Her confusion started improving. That evening Emily found Lena replacing supplies again. Where did you learn all that? Lena smiled. I've read a lot. Emily wasn't convinced. No. You've seen it before. Lena looked down. Maybe. Emily wanted to ask more. She didn't. Because everyone has secrets. Some are simply heavier than others. Lena finished her shift shortly before sunset. She drove home along quiet country roads. Her house sat alone beside an old forest. Inside, there were almost no decorations. No family photographs. No awards. No certificates. Only simple furniture. A single couch. A small kitchen table. One bookshelf. She heated soup for dinner. Halfway through eating, she stopped. Her eyes fixed on nothing. Again. The kitchen disappeared. Dust filled the air. Metal twisted. Someone cried for help. She saw herself wearing different clothes. Different boots. Different gloves. Blood covered her hands. A young man grabbed her arm. Don't leave us. Another voice shouted somewhere deeper inside the collapsing building. There are still people trapped. She reached toward the sound. Then everything vanished. Lena found herself sitting alone at her kitchen table again. Her soup had gone cold. She quietly placed the bowl into the sink. That night, she slept on the couch facing the front door. Just before sunrise, she woke suddenly, breathing hard, hands raised as though protecting someone. The room was silent. No explosions. No screaming. Only wind outside. She slowly lowered her hands, then whispered to herself, "You're home." But somehow, it never truly felt that way. The next morning, Lena arrived at Pine Valley Medical Center even earlier than usual. The sky was still dark, and the parking lot was almost empty. She parked in the same corner, locked her car, and walked toward the entrance with calm, steady steps. Inside the hospital, the night shift was finishing. Nurses exchanged reports while coffee brewed in the staff room. Lena clipped on her student badge and reported to Nurse Emily. "Good morning." "Morning, Lena," Emily replied with a smile. "Room 7 first. Mr. Brooks had another strange heartbeat during the night." Lena nodded and headed toward his room. Walter Brooks was already awake, reading a newspaper. "You're early again," he said. "So are you." "Couldn't sleep." Lena checked his pulse before turning on the blood pressure monitor. Again. There it was. A normal rhythm. Then a pause. Then another. Very brief. Almost invisible. She counted carefully. "Did you feel dizzy again?" "A little." "Any chest pain?" "No." She finished writing her notes. "I'll tell Dr. Blake." Walter smiled. "I knew you would." She looked at him. "You trust me?" "I trust the way you pay attention." Before Lena could answer, Dr. Blake entered the room. "Morning, Mr. Brooks." He reviewed the monitor. "Looks stable." Lena politely handed him her notes. "I noticed another irregular rhythm." Dr. Blake read the page, then looked at her. "You notice everything." Lena remained quiet. "I'd still like an ECG," she said respectfully. Dr. Blake studied Walter for another moment. Finally he sighed. "Fine. We'll order one." Walter smiled. "I guess persistence works." Lena simply smiled back. An hour later, the ECG showed early signs of an abnormal heart rhythm that required monitoring. Dr. Blake looked at the results twice. Then he quietly walked toward Lena. "You were correct." She nodded politely. "It was worth checking." That was all she said. She didn't sound proud. She simply returned to stocking supplies. Emily watched the exchange with curiosity. "You never celebrate when you're right." Lena continued arranging 4 kits. "Patients getting help is enough." Emily folded her arms. "You really are different." Around noon, another emergency call came into the hospital. This one sounded serious. The dispatcher reported multiple injuries after a highway accident. Doctors prepared the emergency department. Stretchers lined the hallway. Extra blood bags were brought from storage. Lena quietly helped organize equipment. She checked oxygen tanks, trauma carts, emergency medications. Everything was ready before anyone asked. Emily noticed. You prepared all this already? I thought we might need it. Minutes later, ambulances began arriving. The first patient was a teenage girl with a broken arm. The second had several cuts and bruises. The third was far worse. A middle-aged construction worker had severe chest injuries. His breathing was becoming weaker every second. Doctors surrounded the bed. Machines began alarming. Dr. Blake quickly examined him. Collapsed lung. The room became tense. One nurse searched for equipment. Another couldn't find the correct tray. Seconds passed. Lena knew exactly where everything was. Without speaking, she grabbed the chest procedure kit and placed it beside Dr. Blake. He looked surprised. Thank you. He immediately began treating the patient. Within moments, the man's breathing improved. Nobody noticed Lena quietly stepping back into the corner again. Except Walter. From his room across the hallway, he had seen everything. Later that afternoon he called Lena inside. You knew exactly what Dr. Blake needed. I organized the supply room. No. Walter smiled gently. You expected that emergency before it happened. I prepared for possibilities. He laughed softly. That's a soldier's answer. Lena froze for just a second. I've never been a soldier. Walter nodded. Maybe not. But you've worked beside them. She didn't answer. Instead, she checked his blood pressure. Walter looked at her carefully. You don't have to tell me your story. I know. But someday, you'll have to tell yourself. His words stayed with her for the rest of the day. Around 4 o'clock, Grace, the elderly woman with the sodium imbalance, was sitting up in bed. She recognized her son. She smiled. I'm feeling much better. Her son hugged her with tears in his eyes. Thank you. He looked toward Dr. Blake, then toward Emily. Finally, his eyes stopped on Lena. Emily smiled. She noticed something important. The man walked over. I don't know exactly what you did. But thank you. Lena smiled politely. I'm glad she's improving. That evening, Dr. Blake called Lena into his office. She looked surprised. Please sit. She quietly took a chair. Dr. Blake folded his hands. I've been practicing medicine for 28 years. Lena listened. In 2 days, you've noticed things experienced staff almost missed. She remained silent. I reviewed your nursing school records. They're excellent. But they don't explain your judgment. Lena looked out the window. I've had experiences. What kind? She hesitated. Emergency rescue. Dr. Blake waited. Where? Lena looked back at him. It was a long time ago. He understood she wasn't ready. I won't push. She nodded. Thank you. As she left his office, Emily was waiting outside. So, he asked questions. And I answered a few. Emily smiled. You know, I think you're one of the best students we've ever had. Lena laughed quietly. I still have a lot to learn. Emily replied. We all do. That night, heavy rain covered the town. Lightning flashed across the mountains. Around midnight, Lena woke again from another nightmare. Only this time, she remembered more. A rescue helicopter. Mountain cliffs. Smoke everywhere. Someone trapped beneath twisted metal. A voice shouted through a headset. Lifeline. We only have 3 minutes. She saw herself running toward danger instead of away from it. Then, a bright explosion. Everything disappeared. Lena sat upright on the couch, breathing hard. She touched the old scar on her shoulder. I couldn't save everyone. She whispered. Tears filled her eyes for the first time in years. The next morning seemed ordinary. But just after lunch, the sound of powerful engines echoed outside the hospital. Every nurse looked toward the front windows. 3 dark military vehicles entered the parking lot. They stopped suddenly outside the emergency entrance. The back doors opened before the vehicles had completely stopped. Uniformed soldiers jumped out carrying a badly wounded man on a stretcher. Blood covered their gloves. One soldier shouted, "We need trauma support now." The emergency department instantly became silent. Doctors rushed toward the entrance. Nurses grabbed stretchers. Lena stood frozen for one brief second. Then her eyes moved across the wounded soldier. His breathing. His injuries. The tourniquet. The blood loss. Every detail. One of the soldiers looked toward her. He stopped walking. His eyes widened. For a moment. Neither of them spoke. Then, in a voice filled with complete disbelief, he whispered, "It can't be." Lena's heart skipped. She recognized him immediately. He was someone from the life she had spent years trying to forget. The soldier stared at Lena as if he had seen a ghost. For several long seconds, the busy emergency entrance became strangely quiet. Rain fell across the parking lot while engines continued to idle outside. Lifeline. The word escaped his lips almost like a whisper. Lena's heart skipped. She knew that name. It was not her real name. It was the call sign she had promised herself she would never hear again. The wounded man on the stretcher suddenly coughed, pulling everyone's attention back to the emergency. Dr. Blake stepped forward. "Move him inside. Now." The medical team rushed into trauma room 1. Lena followed automatically, but stopped just outside the door. She reminded herself, "You're only a student. Stay back." The soldier who had recognized her walked beside the stretcher. His uniform was soaked from the rain, and dried mud covered his boots. His face looked older than she remembered. His eyes carried the same calm focus she had seen years ago. He glanced toward her again. "You really are alive." Lena looked away. "This isn't the time." "No." He nodded. "It isn't." Inside the trauma room, alarms filled the air. The injured soldier was pale. His breathing had become shallow. Blood continued soaking through the bandage on his upper leg. Dr. 80/40. Heart rate. 142. Oxygen. 79. Every second mattered. One nurse struggled to connect the monitor. Another searched for additional force supplies. The room suddenly felt crowded. Everyone was working, but no one seemed completely in control. Lena stood near the wall, silently observing. She noticed something almost instantly. The patient's left chest barely moved. His neck veins looked swollen. His lips had started turning blue. Her mind connected the signs immediately. Pressure inside the chest. Collapsed lung. Not just collapsed. Dangerously compressed. She looked toward Dr. Blake. He was preparing medication first. Lena hesitated. She had promised herself she would never step beyond her role again. But every passing second reduced the young soldier's chances. Finally, she spoke. "Doctor." Dr. Blake looked up. "Yes. I think his chest needs immediate decompression." The room became silent. Dr. Blake examined the patient again. His expression changed. He looked at the monitor, then back at the patient's chest. He realized she was right. Prepare the needle. Everything moved quickly now. Emily handed over the equipment. Dr. Blake performed the emergency procedure. A loud rush of trapped air escaped. Immediately, the oxygen monitor climbed. 79. 84. 90. The patient took a stronger breath. Everyone in the room exhaled with relief. Dr. Blake looked toward Lena. "You saw that before I did." She answered honestly. "I've seen it before." He nodded. "I believe you." The soldier who had recognized her watched quietly from the doorway. There was no surprise on his face anymore. Only confirmation. Once the patient became stable enough, surgeons prepared him for transfer to the regional trauma center. As the flight helicopter approached, the emergency room finally became quiet again. Dr. Blake removed his gloves. He turned toward Lena. "I owe you thanks." "You don't." "Ido." She shook her head. "You saved him. We all did." Dr. Blake smiled slightly. "You never take credit." She looked at the unconscious patient. "No one survives alone." Those words stayed with everyone who heard them. Outside, the helicopter landed behind the hospital. Rain continued falling. The soldier who recognized Lena walked beside her. "My name probably won't mean much anymore." She looked at him. "It will." "Daniel." She smiled faintly. "I remember." Daniel laughed quietly. "You actually remembered." "I remember everyone." His smile slowly disappeared. "We searched for you." "I know." You changed your phone. Yes. You moved. Yes. You never answered. I wasn't ready. Daniel nodded. I figured. They stood silently watching the helicopter crew prepare the patient. Finally Daniel spoke again. Do you know what everyone thought? Lena looked at him. They thought you were dead. She lowered her eyes. In a way. I was. Daniel understood exactly what she meant. You blame yourself. She didn't answer. You still think about that mission. Her silence answered for her. Daniel sighed. It wasn't your fault. Lena finally looked at him. You weren't inside. No. You didn't hear them. Daniel remained quiet. She continued softly. I still hear their voices. Rain hid the tears beginning to form in her eyes. I chose one life. You saved the one you could reach. I left another behind. Daniel stepped closer. You were ordered to leave. I still walked away. For several moments neither spoke. The helicopter lifted into the cloudy sky carrying the wounded soldier. Both watched until it disappeared. Back inside the hospital, Emily found Lena cleaning equipment. You always clean after emergencies. It helps. Emily leaned against the counter. I've been wanting to ask you something. Lena smiled. I know. Were you military? She thought carefully. I worked with rescue teams. Emily waited. In dangerous places. Yes. Did people die? Lena closed her eyes briefly. Sometimes. Emily reached over and gently touched her shoulder. I'm sorry. Lena looked surprised. Why? Because I don't think anyone comes back from that completely. Those words stayed with Lena long after Emily walked away. That evening Walter Brooks called her into his room. I heard there was excitement today. She smiled. A little. You were involved. I helped. Walter laughed. There you go again. What? Making yourself smaller. She checked his pulse. It was steadier than yesterday. I'm only telling the truth. Walter looked directly into her eyes. The truth isn't always complete. She stopped writing. You've spent years convincing yourself that you're ordinary. I'm a nursing student. You're also someone who runs toward danger, while everyone else freezes. She looked away. I don't want attention. No. Walter nodded. You want peace. She couldn't argue with that. Because it was true. Later that night, Dr. Blake reviewed security footage from the emergency. He watched Lena several times. She never panicked. Never wasted movement. Never raised her voice. Everything she did was calm. Measured. Purposeful. He quietly closed the computer. Then he walked to the staff lounge where Emily was finishing paperwork. I've never seen anyone work like that. Emily smiled. I noticed. She's hiding years of experience. I think she's hiding pain. Dr. Blake looked toward the hallway. Maybe both. The next morning began peacefully. Patients smiled. Children laughed in the waiting room. For the first time in days. Lena felt almost normal. Until she opened her locker. Inside sat a small white envelope. No name. No stamp. Only one sentence written neatly on the front. Some memories never stop waiting for us. Her hands became cold. She slowly opened it. Inside was a single photograph. A rescue team standing beside a helicopter years earlier. She recognized every face. Including her own. On the back. Only 4 words were written. You finally came home. Lena stared at the photograph. Someone from her past had found her. And she knew. Her quiet life at Pine Valley Medical Center was about to change forever. Lena stood motionless, staring at the old photograph in her hands. She recognized every face. Some had become close friends. Some had moved away. Some had never come home. Her own face looked younger. Stronger. More confident. She slowly turned the photograph over again. You finally came home. Those 4 words stayed in her mind throughout the day. She carefully folded the picture and placed it inside her locker. Then she walked back onto the hospital floor as if nothing had happened. Patients still needed care. Monitors still beeped. Life continued. That afternoon, Walter Brooks was finally cleared to go home. Lena helped him pack the few belongings he had brought to the hospital. Walter smiled. I guess this is goodbye. I hope not. I'll probably come back. She looked surprised. For another heart problem? He laughed. No. For coffee. She laughed for the first time in days. I'd like that. Walter slowly stood with his walker. Before leaving, he handed her a small wooden coin. One side showed an old oak tree. The other simply read, Stand tall. My father carried this during the war, Walter said. I want you to have it. I can't accept this. You can. He placed it gently into her hand. You spend too much time remembering the people you couldn't save. Lena looked at him quietly. Walter smiled. Start remembering the ones you did. Without another word, he slowly walked toward the exit. Lena watched until he disappeared through the front doors. For the first time in years. She slipped the wooden coin into her pocket instead of hiding it away. The following week passed peacefully. Grace recovered enough to return home. Several children visited the pediatric ward carrying handmade thank you cards for the nurses. One little girl walked directly toward Lena. This is for you. The drawing showed a smiling nurse wearing a blue uniform with a bright yellow cape. Lena smiled. I'm not a superhero. The little girl shook her head. My mommy says superheroes don't wear capes. They help people. Lena carefully folded the drawing. Thank you. She pinned it inside her locker. Days later, Dr. Blake called a staff meeting. Doctors, nurses, students. Everyone gathered in the conference room. Dr. Blake stood quietly for a moment before speaking. I've worked in emergency medicine for nearly 30 years. Everyone listened. I've learned that experience matters. He looked around the room. But I've also learned something else. His eyes stopped on Lena. The best ideas can come from anyone. Several staff members glanced toward her. If you see something. He continued. Speak. It doesn't matter whether you're a student, a nurse, a technician, or a physician. What matters is helping the patient. Emily smiled proudly. Everyone applauded. Lena looked down, slightly embarrassed. After the meeting, Dr. Blake stopped her in the hallway. I have something for you. He handed her a sealed envelope. Inside was a recommendation letter. Lena looked surprised. Doctor. You've earned it. She slowly opened it. The first sentence made her emotional. Lena Carter has demonstrated judgment, compassion, and leadership beyond her years. She looked back at him. I don't know what to say. You don't need to. He smiled. Just promise me something. What? When you become a nurse. Never stop speaking up. She nodded. I promise. Several weeks later, Lena officially completed her final clinical evaluation. Emily hugged her tightly. You passed. Lena smiled. I was hoping. Emily laughed. You didn't just pass. You finished at the top of the program. The entire nursing staff applauded. Even Dr. Blake smiled. That evening Lena drove home through the same quiet roads she had traveled every day. But something felt different. She no longer parked far away from every building. She no longer searched every shadow. For the first time in years, she rolled down the car window and simply enjoyed the fresh evening air. When she reached home, someone was waiting outside. Daniel. He stood beside an old pickup truck. Lena smiled. I thought you left town. I did. I came back. He held out another envelope. This one isn't from the military. She opened it. Inside was a newspaper. On the front page appeared a headline. Rescue Team honors fallen heroes with new memorial scholarship. Below the headline, she saw a familiar photograph. Her former rescue team, including Mason. Her eyes filled with tears. Daniel spoke softly. Mason wrote something before he died. She looked at him. He left letters for several people. He handed her one final envelope. Her hands trembled. Slowly, she opened it. Inside was a handwritten letter. She immediately recognized Mason's handwriting. If you're reading this, then life took us in different directions. I know you. You're probably carrying guilt that doesn't belong to you. If you're still blaming yourself, stop. You gave me another chance to live. Everything I experienced afterward happened because you refused to quit on me. Every sunrise, every laugh, every mountain I climbed, every child I helped rescue. You made those moments possible. Don't waste your future trying to repay a debt that never existed. Live the life you fought so hard to protect. And when someone needs help, don't hide from who you are. Your friend, Mason. Lena couldn't stop the tears anymore. Years of pain seemed to leave with them. Daniel quietly stood beside her. Neither spoke. Neither needed to. The following morning, Lena returned to Pine Valley Medical Center one last time as a student. She walked through the entrance. The same hallway. The same waiting room. The same emergency department. Only this time, she wasn't trying to disappear. Emily handed her a small box. Inside was a brand new hospital name badge. It read, Lena Carter, registered nurse. Lena looked at it for several seconds, then smiled. I finally made it. Emily laughed. No. You finally accepted who you've always been. Months later, Pine Valley became one of the highest-rated emergency hospitals in the region. Dr. Blake introduced new training sessions where every staff member, regardless of title, could share safety concerns without fear. Several serious medical mistakes were prevented because people spoke up. Walter visited every Friday for coffee. Grace returned with homemade cookies for the nursing staff. The little girl who drew the superhero picture came back for a routine checkup. This time she wore a toy nurse's badge. I want to be like you. Lena knelt beside her. No. Be even better. The little girl smiled. I will. As the years passed, Lena became one of the hospital's most respected emergency nurses. New students often wondered why she stayed so calm during impossible situations. She always gave the same answer. Stay focused on the person in front of you. Fear gets louder, but compassion must stay stronger. One evening, just before sunset, Lena stood outside the hospital watching another helicopter disappear into the distance. Years earlier, that sound had reminded her only of loss. Now, it reminded her of hope. She reached into her pocket. The small wooden coin Walter had given her was still there. She smiled, then quietly whispered, "Thank you." Not to one person, but to everyone who had believed in her when she couldn't believe in herself. Because she finally understood something that had taken years to learn. Real heroes are not the people who save everyone. They are the people who keep helping, even after discovering they can't.